chapter 3 is very important chapter which we need then for the management planning, my dear. Lab investigation of the dengue diagnosis and the management. Let's see what is written in chapter 3, the lab investigation for the dengue diagnosis and management. Dengue virus, which has the 4 distinct serotypes, then 1, 2, 3, 4, early laboratory investigation confirmation of the clinical diagnosis may be important because some patients progress within a very short period of time, mild to severe, and sometimes to death. Early intervention is a life-saving. What? Early intervention is a life-saving. The lab test of the diagnosis and the monitoring. The management of the DS, dengue syndrome, is based on the clinical judgment rather than laboratory evaluations alone. So here's that clinical judgment. However, few indirect tests may be suggestive of the dengue syndrome from the outset. The following test may be done: the complete blood count. Here's the single test, the CBC, my dear, including the total leukocyte count, the total blood count, and hematocrit should be done on first consultation of the patients to have the baseline. Recommendations are all febrile patients the first visit within the one week, and all the patients with the warning signs. Leukopenia is common in both adults and children with dengue fever and has an important diagnostic implication in early period. So leukopenia. The change in total white cell count is less than 5,000 and ratio of neutrophils to lymphocyte. This is important. The ratio to neutrophils to lymphocytes is useful to predict the critical period of plasma leakage. Means the critical phase. This finding precedes the thrombocytopenia, rising packed cell volume. This change is seen in the dengue fever and dengue hemorrhagic fever both. So once again, the leukopenia as well as the ratio to the neutrophils to lymphocyte. Yes, my dear, means the neutrophils less than that of the lymphocytes is useful to predict plasma leakage. Thrombocytopenia is features observed in dengue fever, mild 1 lakh to 1,50,000 is common. About half of all dengue fevers should have the platelet count below the 1 lakh. A sudden drop of platelet count to below the 1 lakh occurs before the onset of the shock or subsidence of the fever. So while the fever subsided, the thrombocytopenia starts. As we have seen in the critical stage, means the plasma leakage when starts. The level of the plasma platelet count is correlated with the severity of dengue hemorrhagic fever. Severe thrombocytopenia less than 1 lakh usually precedes or accompanies overt plasma leakage. So yes, the severe thrombocytopenia is an overt plasma leakage. So as we have seen that the plasma leakage, as with the platelet count, is a box shape in the critical shape. So plasma leakage, yes, that leads to the packed cell volume arrow up, and also the platelet count getting down. That is the critical phase of thrombocytopenia. So what we found in, yes, the complete blood count, we found the leukopenia, we found the neutropenia, and also sometimes the lymphocytosis is the predictions of the plasma leakage, and along with the thrombocytopenia. And hematocrit, the packed cell volume. So a slight increase which may, due to the high fever, anorexia and vomiting, means the 10%. A sudden rise of hematocrit is observed simultaneously and shortly after the drop in platelet count. Hemoconcentration, rising hematocrit by 20% from the baseline, from hematocrit of 35% to 42%. 35 to 2 means 7, 7 plus 35 means the 42. So it's objective evidence of leakage of plasma. So plasma leakage means the packed cell volume rising, and that should be more than 20%, my dear. We call the significant plasma leakage. It should be noted that the level of hematocrit may be affected by early volume replacement and by bleeding as well. So yes, starting the complete blood count is the leukopenia, thrombocytopenia, and packed cell volume. So the P's Once again, the P for Paxil volume, my dear. P for platelets. And P for, once again, the Peneus or the leukopeneus. And the biochemical test, yes, my dear doctor, at GPT and at GOT, the AST and LG are frequently elevated in both adults and children with the dengue fever and dengue hemorrhagic fever. AST and LG levels are higher, 5 to 15 times the upper limit of normal in patients with dengue hemorrhagic fever, 5 to 15 times. So commonly AST is more than ALT in these cases. In special cases, hypoproteinemia, hypoalbuminemia, as a consequence of the plasma leakage, hyponatremia is frequently observed in dengue hemorrhagic fever, is in more severe shock. Hypocalcemia is a corrected for hypoalbuminemia, has been observed in dengue hemorrhagic fever. Metabolic acidosis, once again, is found is a profound shock, and blood urea nitrogen, yes, is elevated with prolonged shock. So yes, along with that, you can make a box for the biochemical test. Yes, the biochemical test that you can do the biochemical test. You can make a box for the biochemical test. Once again, A for, yes, AST and ALT, and B for, yes, you can write down the blood urea nitrogen, and C for, you can write down the C for calcium, yes, and once again C for the C's means the acidosis, means the acidosis, once again, and along with that you can write down the A for albumin plus, and yes, you can write down the sodium, hyponatremia plus sodium. So yes, my dear, so here is also you can write down the sodium in that way, yes, so that you can remember the biochemical test, the AST, ALT, albumin, sodium, and also once again N for sodium, yes, the B1, the blood urea nitrogen, calcium, and C dose is the bicarbonate level that you need to see. So the biochemical test, along with the coagulation profiles. Once again, the assays for the coagulation fibrinolytic factors show the reduction in DGHS cases. Partial thromboblasting time and prothrombin time are prolonged, means the PT and ABTT in half and 1/3 of the DGHS cases respectively. Thrombin time is also prolonged, the TT in severe cases. So other tests like the urine RE for albuminuria, stool test for the local blood test, chest X-ray ultrasonography for detection of proliferation ascites, and other tests for exclusion malaria, typhoid fever may be required for the patient with the compatible clinical syndromes, and other tests as and when clinically indicated, especially dengue expanded syndrome, serum albumin, liver function, renal function, serum electrolytes, imaging, ECG, echocardiography, and CSF, etc. It should be noted that the use of medications such as analgesics, antibiotics, antibiotics can interfere with the liver function and blood clotting. So, the basic test, if you see the basic test, so biochemical test here, and then you see some of the spatial tests altogether, and some of the coagulation profiles along with the complete blood count. So if you do a box for the lab test for the dengue fever, yes, the comprehensive dengue fever and with the severe syndromes, so you must do at least the CBC, the complete blood count, and once again the other test that you have seen, that some of the biochemical test and also some of the coagulation profiles. So here's the coagulation profiles, and once again you have write down that the C dose is calcium, yes, that the test that you do, some of the biochemical test. So calcium, acidosis. So why I'm saying these are the biochemical tests, so that you can remember. So once again, that the CBC is nothing but, if you write down the CBC is nothing but once again you have to very look for the PCV and the platelets, along with the eosinophenia, means the leukopenia. And coagulation profiles are nothing but, if you write down once again, nothing but the P's. And what does the P for? Is the APTT and PT, and also the TT. And once again, the calcium C dose is the biochemical test that you already have done, the ABCD. So ABC, yes. So these are the lab tests that you need to remember. The summary box with a complete blood count. You have the Paxil volume, platelets, and penia, and coagulation profiles. Once again, the APTT, PT, so PT, APTT, so PPPs. Yes, yeah. And also the calcium C dose. I put all the C's here. Biochemical test that I already boxed the ABC, so that will be helpful. Time and frequency of doing investigations. Within 3 days, the box minus CBC, hematocrit, NS1 antigen, HGOT, and HGPT. Yes, my dear. That these tests should be done during the first consultation to get the baseline characteristics like the hematocrit and complete blood count if the platelet presented within the, or the patient presented within 3 days of fever. So within 3 days, yes, my dear, the CBC, NS1 antigen, and this liver biochemistry. So if you write down within the 3 days, I'm making a box. This is very important. The dengue fever, within a 3 days, do the 3 tests. I'm making a box with the 3 tests. And these 3 tests are nothing but the CBC, that includes, of course, the Paxil volume as well as the platelets, and plus the dengue NS1 antigen. Yes, antigen, and plus, this is very important, AST and ALT. So yes, my dear doctor, the 3 days, the 3 tests. Yes, the 3 days, the 3 tests, and these are nothing but, once again, the CBC, antigen, and once again the AST and ALT test. And these tests should be done during the first consultation to get the baseline characteristics like the hematocrit and complete blood count if the patient presents during the 3 days of the fever. Follow-up testing may be done on the first febrile day, but should be done daily once the DGHS is suspected. I say that daily. A regular hematocrit means the Paxil volume is more important management than that of the platelets, because the Paxil volume will give you the idea of plasma leakage. Even in severe dengue, especially with the shock, hourly hematocrit, Paxil volume in case of severe dengue with the shock is crucial for the management. Once the platelet count begins to rise and reaches more than 50,000, daily labs may be discontinued. So yes, my dear doctor, that can be done. This is very much important to know about it. The test should be done daily, of course, the hematocrit, but in severe dengue, especially with the shock, the hourly hematocrit, hourly Paxil volume. In case of DSS, this is very important. The DSS, dengue shock syndrome, that hourly Paxil volume is crucial rather than platelets. So hourly Paxil volume is crucial for the management planning. And once again, the daily lab evaluations should be discontinued when the platelet count more than P for 50. 50,000, so that you can remember. So for the clinical purpose, the complete blood count and antigen AST/ALT should be done within 3 days. Confirm the diagnosis and guides for monitoring the management. So the two important box that I discussed here, the dengue fever within 3 days, 3 tests, CBC antigen, NS1 antigen and AST/ALT test, and also in severe, means the shock, means the dengue shock syndrome, in that case the hourly paxil volume with the platelets rather than the platelets, hourly paxil volume. Dengue diagnostic test, detection of antigen is NS1 antigen, which called the non-structural protein 1 antigen. NS1 antigen rapid test positive within minutes of starting symptoms. ELISA NS1 antigen will be positive on first day of illness. So ELISA can be done, but these rapid tests we do, this test becomes negative from day 4. So day 4. So NS1 can be negative from day 4. Commercial kits for the detection of the NS1 antigen are now available in ELISA and rapid test format. Dengue IgM and IgG test, make ELISA rapid ICT. Anti-dengue IgM specific antibodies can be detected after 5 days. What I said? After 5 days. So yes, my dear, the NS1 antigen becomes positive. Yes. Up to 4 days, or yes, that test becomes negative 4 days. So within 3 days the NS1 is positive. So NS1 for 3 and 4 and 5 is a window period. So after 5 days means the 6 days. So if you can remember the IgM antibody, if a box, that will be helpful. So NS1 antigen equal to 3 and IgM antibody equal to 6. That will be helpful, my friend. So yes, it can be detected at low level after 1 to 3 months after the fever, and the onset of the fever highest level achieved after 7 days. Yes, IgM antibody specific and it can be detected after 5 days. What I say means the day 6, and the highest level achieved after 7 days means day 8. And it can be detected in low level up to 1 to 3 months after fever. And in primary dengue infection, IgM will be more than IgG early period, and also IgG at 9 or 10th day of the fever. Level of the IgG may persist at low levels of decades, indicating the past dengue infection. So in the primary infection means the IgM will be the more than that of the IgG, and in secondary the IgG, higher elevation of the IgG and lower levels of the IgM, and higher IgG level remain for 30 to 40 days. Rapid ICT test provides a result within 15 to 20 minutes. So doing the IgG and IgM test is very effective to know the secondary infections. For the secondary infections, my dear, that you need to know the IgG is higher than that of the IgM, but the primary, the IgM is greater than IgG. So yes, the summary talk here, the detection of diagnostic test, the NS1 antigen day 3, and after 4 and 5 can be negative, but the IgM test becomes positive on day 6. So NS1 3, IgM 6, or 3 6 will be helpful. Say it would be 3 6 3 6 3 6, just the number, that will be helpful. Nucleic acid detection, the reverse transcript is PCR, RT-PCR. Yes, the confirm the diagnosis within 5 days of illness. So confirmatory test, of course, the RT-PCR. The amplified DEN viral RNAs can be detected either by tradition or real-time PCR. This test is expensive and available only in referral centers. Dengue viral isolation. The virus isolation from serum, plasma, and leukocytes is the most definitive test for the dengue infection. So here's the viral isolation, like the bacterial isolation in the culture. So here, the isolation is the most definitive dengue infection, which can be accomplished in majority of the cases, if the sample is taken in the first few days of the illness, isolation of the dengue virus from serum, CSF, or autopsy samples, detection of dengue virus or antigen in tissue, serum, or CSF by immunohistochemistry, immunofluorescence, or enzyme-linked ELISA, and detection of dengue virus genomic sequence by RT-PCR. So yes, my dear, so the nucleic acid detection with the RT-PCR confirm the diagnosis, but the definitive is the viral isolation. So once again, the box for the confirmed diagnosis equal to RT-PCR, and once again the definitive, of course, is nothing but viral isolation. Make the box, my dear. The tests for objective evidence of dengue infection are not helpful for guiding the management. NS1 is a non-structural protein. Rapid antigen is an excellent test for confirmation of the dengue syndrome. So doing an NS1 test is a simple and can be yes for the confirmation of the dengue syndrome. So viral detection and its components, serological response, clinical sample like the acute serum, 1 to 5 days of fever, necropsy, tissue like viral isolation, nucleic acid, and antigen detection. And methodology is given here, that different varieties of serological tests, how this can be done. So yes, time and frequency of investigation. Available dengue diagnostic tests at different levels of the healthcare centers, the primary healthcare and secondary and tertiary. For diagnosis surveillance purpose, the primary care, the rapid test for the dengue specific IgM, IgG, and dengue NS1 antigen should be used. Secondary care, the district level, both ELISA and rapid tests for the detection of antigen antibody can be performed. And tertiary, all diagnostic methods should be available at reference centers, including the viral isolation like the RT-PCR and all serological techniques. So here is also given primary, secondary, and tertiary level what things are really available. So doing an NS1 antigen and IgM, IgG that are really absent in primary, but the district level is available and tertiary level is available. And tertiary level, of course, the viral isolation as well as the RT-PCR is available in the reference center. But in tertiary level, we do the NS1 antigen and IgM, IgG antibody detection. And confirmed and probable dengue diagnosis interpretation of the results. So confirmed dengue infection, the viral isolation, genome detection, antigen detection, and probable dengue infection like the IgM seroconversion, IgG, positive IgM, and high IgG levels. So doing only the positive NS1 antigen is bold here, and from negative IgM to positive IgM in pair sera and positive IgM. So this is the the confirmed and probable dengue diagnosis. So positive NS1 antigen and from negative IgM to positive IgM in acute serum days 1 to 5, and positive IgM once again collected after day 5. So this is the confirmed dengue positive NS1 and probable dengue once again positive IgM